I know you're in pain, or you know somebody that's in pain, and it's gone on for over 3 months, maybe longer, and it's considered chronic pain, and you're frustrated, you're angry, you're anxious, depression may be even setting in because you just don't know, "Is this the best it's gonna be? Is this my new life?" Stay with me today on the Defeating Pain podcast so that I can provide answers to why you're having the pain and even possible solutions.
Welcome to the Defeating Pain Podcast with Dr. Ted Arkfeld. If you're tired of treatments that just don't work, you're in the right place. Each week, we'll talk about new ways to beat chronic pain using at-home therapies. You don't have to go to the doctor to feel better. Let's help you start living pain-free. Now, here's Dr. Arkfeld.
Thanks for staying with me. Thanks for not just continue to click forward and remaining with me. I'm going to talk to you today like I would talk to a patient that had come in, and we see a lot of these types of patients. They're in chronic pain. They've been everywhere. They have been to other chiropractors for a prolonged treatment. They've been through epidural, spinal injections. They've been to PT, numerous rounds of PT, and they're still in pain. And nobody is giving them any kind of path forward. They don't know really what's causing their pain, and that's what they hear from specialists. "I don't know. I just don't know what's causing your pain. Let's keep doing the same of the same." Okay, that just isn't going to work. In earlier episodes, I talk about more care is not what's needed. A different approach of care is what's needed. So, let's say that you're sitting in my office. I've done the history, your story. You've told me a complete story. I've done the examination, and now I'm gonna sit down and tell you what I've found. So here's what I found. I found that you've got some limited range of motion, and that's due to the muscles being extremely tight in your low back and that you can't fully move. You've got joints back there in your vertebrae, and where the vertebrae stack up on one another, they're called facet joints, and they're not moving. And the muscles deep down, they're called multifidus muscles. They're not functioning right. And when they don't function right, it creates instability in your low back. But more importantly, that sends signals up to a part of your brain called the cerebellum. The cerebellum is responsible for movement, for balance, for coordination, for a lot of different things. And the cerebellum is not getting that information like it needs to make sure that number 1, your spine is stabilized, and number 2, you can move properly, and not only move properly, but move properly in a pain-free type of an zone, basically. So, everybody has approached your condition from an orthopedic condition, and I'm looking at it from a whole different way. I'm looking at what's going on with you from the lens of your nervous system. And you may have started out with an orthopedic problem, but what you have now is a neurological problem. Basically, the signals from all the receptors in our body, and you have receptors in those joints, you have receptors in the skin, you have receptors in the muscles. They're not making it up to the brain. So the brain doesn't know what's going on down there in the low back, and it's gone into a protective mode. And so nobody's addressing it's really your central nervous system and your peripheral nervous system. You're in a bad cell coverage area when it comes to your low back. Signals just aren't getting there. Now you add the final piece of the puzzle here is that you're anxious, you're depressed, you're not sleeping well. And that all, really contributes to what's going on. You see, where all that information has to get up into your brain, right next door is the limbic system, and that's our emotional system. So they're in the anatomical neighborhood up in your brain. You can't have pain without it being emotional. You know that. And I imagine right now, your hopes have probably really dwindled many times. And you're sitting across from me and you're going, I want to believe. I really do want to believe. But I've been led down this road so many times that I just don't know if it really is going to work. I can tell you that even though I can't give guarantees, We have succeeded where others have failed so many times. I could tell you so many stories. And so the answer is not more care. The answer is that you've got to have strategic therapies directed toward your nervous system. Now, you may be thinking, I have to go back. I've got to go to somebody. Not necessarily. All right. You can do a movement analysis at home, and I can send you the link. You just send me an email and you tell me that you want to do a movement analysis, and I'll send you a link to be able to get that done. Then I can analyze your movement. Then we can get you on home-based therapies. You can create your own home remedy kit, so where you don't have to go in to an office visit. Now, I'm probably gonna recommend another chiropractor in your area that does a specific technique that is really good for what we need to get accomplished, and it won't be painful. So, you see, the time for you to lose hope, it's not there yet. I need you to stay with me. I need you to send me that movement analysis. I need you to listen to really what I'm saying because you can reduce your pain. I don't know by how much. We have really good success, but I do know you don't have to live this way. Barbara came to me about 3 summers ago, and she had just had surgery on her low back and had gone through 8 weeks of PT and was still in pain, and they told her, "We need to do more PT," and she said, "Well, do you think that'd work?" And they go, "We don't know. We don't really know why you're still having the pain." So Barbara had the surgery down in Florida and had come back up here to Northern Michigan for the summer and came in, and the poor lady was in tears. She said, "I just wanna golf. I just want to golf with my husband this summer." So after doing the history of the exam, I had the same conversation that I'm having with you. I said, "Barbara, you're not gonna have to live this way." They've been looking at it from a neurological lens. They've been looking at it from an orthopedic lens. We're gonna look at it from a neurological lens. Fast forward 2 months, Barbara was out playing golf. Now, it didn't take the whole 2 months. I had her going fairly quickly doing the short game, which as a golfer, we all know that's the most important anyway. But anyway, she was back out playing golf by the end of the summer. If it can happen to Barbara and it can happen to loads of others, I want you, first of all, please comment. Share your story in the comments. I'm not even gonna ask you to subscribe yet because we're still in the dating phase of our YouTube relationship. So you don't have to subscribe yet. Only subscribe after you watch a few more episodes and you think, "Maybe this guy knows what he's talking about." Then subscribe, and then tell others, okay? Because I'm not gonna do pre-scripted YouTube videos anymore. I tried that, and I just didn't feel like I was getting across what I really want to achieve with this podcast, and that help the people that don't think help is available to them anymore. That breaks my heart. I grew up in a chronic pain family. I know what it's like to have a father in pain, low back pain every single day. 3 spinal fusions and finally declared disabled, fully disabled. And sometimes it wasn't really nice being around him. All right. So I understand. I probably understand more than anybody does. And I've dedicated my life in the search of helping people get pain free. I've dedicated my professional career to defeating pain, and I want to do that for you.